Okay. Hello and welcome to using farm to fork technology to deliver personalized nutrition. So I'm Jenna from MealSuite, and today we have very special guests, Amanda Lynch and Cathy Mosley from US Foods, as well as our own Noel Slaughter from MealSuite as well. So looking back on last month's Nutrition Month, the theme was Beyond the Table, which talks about the farm to fork aspect of nutrition. So from procuring ingredients through to it actually being on the table, in our case for residents and patients. So today we're going to be diving into how food service technology can help you support that and also deliver personalized nutrition every step of the way. So welcome, ladies. If we can start by having everyone introduce themselves and tell us a little bit about your experience in the industry. So if we can start with Amanda.
Yeah, thank you. My name is Amanda Lynch, and I'm a registered dietitian. I started my career working as an inpatient clinical dietitian in a large acute care facility, and I joined US Foods almost 2 years ago as a corporate menu specialist working with healthcare customers.
Awesome. And Cathy?
Hi, I'm Cathy Mosley. I'm also a registered dietitian, and I started my career about 20 plus years ago in acute care as a dietitian, director of food service, and then over a period of time, I've worked with senior living customers as well as private consulting, and I currently work for a distributor as a field menu specialist.
Awesome. So happy to have you. And Noel?
I'm Noel Slaughter. I'm a registered dietitian as well. I have just over 15 years experience in the industry. My experience is in both acute care and long-term care in clinical and food service management, including experience in implementing food service software, recipe creation, and menu development. And I've been with MealSuite as the manager of nutrition services for about 2.5 years now.
Amazing. So it sounds like we have the right people to talk about this today. Going back just to the title, Farm to Fork Food Service Technology. So can you tell us what does that mean? Starting with Amanda?
Yeah, absolutely. Farm to fork food service technology means that the technology is designed to be an end-to-end platform, streamlining the food service operation. So from creating shopping lists and placing orders, all the way through serving hot, delicious meals to patients and residents. The technology has the ability to connect all of those areas of a food service operation.
Yeah, I'll elaborate on that a little bit as well. The farm to fork concept really has a focus on sustainability and efficiency. So technology can really support this in a variety of ways. One of those ways is with waste reduction. So when you're utilizing a technology in food service, you can have a lot more accuracy related to what you need to purchase, what you need to produce. So that accuracy really helps avoid overproduction and really waste production in the long run. It can also really improve efficiency, like Amanda said, from end to end, from all the different aspects, from designing the menu to purchasing the food and delivering the food. And there's also an aspect that technology can play in safety and quality assurance. So technology can support things like temperature monitoring and temperature tracking, and then implementation of HACCP protocols as well, to really improve the quality and safety of what you're serving to residents. So overall, food service technology really aims to promote wellness, sustainability, and transparency through the whole process, from procurement to preparation to delivery.
That's awesome. And so a lot of these integrated technologies have people profiles that are integrated within the software. How can those enhance efficiency and effectiveness in the overall dietary management community, within a community?
Yeah, I can take that one. So having people profiles integrated into a software can further streamline food service operations by having menus and resident information all in one platform. People profiles can house diets and textures, likes, dislikes, and allergies, food preferences, and even dining preferences. People profiles are a great way to improve satisfaction by ensuring individuals are being served foods that they like, that they're allowed to have, but it also can mitigate any risk that, that's something that Noel alluded to before.
Yes, definitely. And kind of to that point, how does food service technology make it easier to build those personal menus, really personalized to the resident, including factors like taste, nutritional needs, and dietary restrictions? And I'll pass that one to Cathy.
Okay, yeah, great. I can answer that. And, those are so important. We're seeing a lot of cultural diversity now within our residents, and then a lot of diet preferences as well as therapeutic diet needs. So those are really important to consider and to make sure that we don't forget those likes and dislikes and preferences, and we can distinguish between an allergy and a preference. So it's a lot to try to remember without technology. Technology really helps keep track of all of those things because also, I think it's really common we don't just have one cycle menu running on any given day. We have multiple menus. So, we could have an always available menu, a snack menu, a special event menu, a holiday menu, and a cycle menu. It's really difficult to remember all of those preferences and allergens and maybe, respect those cultural differences of our residents without having that technology. I just believe it is really key to ensuring not only just being respectful of those preferences, but also compliant to the importance of those therapeutic diets. Safety is and should always be a priority.
Absolutely.
Yeah, when it comes to compliance, like Cathy mentioned, there's so many things that food service technology can really help with. So abilities for nutritional analysis, not only, the menu as a whole, but even single menu items, if they're compliant for a certain resident based on their diet order as prescribed by the physician. Also allowing customization abilities, with the preferences and the likes and dislikes. It's not something that staff need to remember, or, the days with notes on the tray line of, certain residents' preferences. This is all really built and housed into the system. As well as allergen management, being able to track allergens and identify recipes and menu items that could be offenders of this allergen really helps improve the overall safety, since those items would automatically be removed from these personal menus and it wouldn't rely on staff to be able to identify these allergens on the tray line. So safety is really mitigated the risk there. Another aspect that I wanted to touch on is the integration with other health data systems like electronic medical records. So a lot of times nurses may be gathering information on preferences or allergens when the resident is first admitted and putting that into the electronic medical record. And so having the ability for that information to flow all the way to the food service software really makes things more efficient for staff, and really make sure that that information that the patient's already provided is tracked, so they don't have to provide that again to someone else, or they don't receive something on their tray when they already explained to the nurses that that's not something that they like. So kind of closing that gap between the medical record really can improve efficiency. And then also with recipe development tools available in software, oftentimes chefs and food service managers are really strapped for time. So creating these new seasonal recipes can be a big load on their plate. So having these tools available to them where it's really easy to create these new recipes, or there's already seasonal recipes available in the software that they can choose from and modify to meet their needs, really takes a piece of that load off the food service manager by having these tools available to assist them.
Yeah, absolutely. And going back to kind of the beginning of the process, which is procuring your ingredients, kind of the farm aspect from what we're talking about today. How does food service software help you with your purchase orders, with integrating with that process? If I could give that one to Cathy.
Yeah, I'd be happy to talk about that. So the websites talk to each other, just, for layman's terms, they can communicate. And that is really nice because that matches up those ingredients in your recipes to items that you're purchasing from your distributor. So instead of having to, go through all that paperwork and time trying not to forget, especially in the example I was speaking of earlier, where we have, special events and multiple menus running, and then we've got those preferences and allergens and all that to consider, where we might have made some changes to the menu for customized menus. The system is able to keep track of that for you and create an ingredient list, a shopping list, per se, that you can rest assured will have every ingredient that you need, on that list, and that matches it up to, products you're purchasing from your distributor. So talk about a time saver, just a really significant time saver. So then you can take that list and match it up against your inventory, eliminating, increasing, decreasing number of cases. But that, significantly, it's a time saver. So I think that integration, that those two systems talk to each other, man, that's such a great value, that MealSuite can provide.
Definitely. So what are some of the challenges of not using technology for food service operations? And I'll pass that one to Cathy.
Okay, yeah. So without technology, it can be really challenging to keep plan, on a day-to-day basis. So, for example, I see a lot of, oftentimes utilizing Excel spreadsheets, manual tallies, going around, making manual tallies of residents' preferences for meals. Choices might change at the last minute, and so that's changing things with production, and all of these things are kind of happening on the fly. And then you still have your workload, your daily workload, and if you're trying to run in and out of meetings and try to, updating Excel spreadsheets and hand tallies, it's so easy to have human error. And if technology is taking care of that instead, it's freeing up your time, but it's also eliminating a lot of human error, in my opinion.
Even just down to like recipes and menus, right? Like it eliminates the need to do manual diet extensions. The platform can do that for you, which is a huge time saver, and as well as mitigating any risks, right? We're making sure that the residents are getting food that's safe and compliant for their diet.
That's exactly right. Yeah, good point.
Yeah, it definitely streamlines everything, especially for special diets and extensions, like you mentioned. So Noel, earlier on, you touched on how technology can help support with reducing food waste. Can you elaborate a little bit on that?
Yeah. So just like Cathy and Amanda were saying about tallying and production reports, so having electronic production reports that provide the exact amounts that you need to make can really eliminate waste. So with manual processes, there's always some level of guesswork, and the systems really eliminate that and make things really accurate. So not only is your production based on your exact census for that time, but your recipes are scaled for the exact amounts that you need to. So you don't need, your staff producing for 75 when you really only have 66 patients that day that are requiring that menu item. So it really customizes your production so that you're ultimately reducing the waste and not overproducing, which can happen quite a bit. On top of that, these production reports, they also include all of the personal menu items, as we were discussing before, so that you are really making the food that people want. So you don't want to be overproducing food when someone's going to say, no, this isn't what I want. I'll just take, a peanut butter and jelly. You're going to know ahead of time what your residents are wanting to eat. You're making the food that they are ordering without overproducing food that could possibly be unwanted.
Yeah, that makes so much sense. I'm sure there's people that, send something back and like you said, ahead of time what they like to eat. And for anyone who's kind of curious about getting started with technology or upgrading their technology in their own community, do you have a number one piece of advice for them at this stage? And I can start with Amanda on that one.
Yeah. So I would say my biggest piece of advice is to just be patient, right? Switching to a food service software or deciding to upgrade your software can certainly be daunting. There's a lot of information to learn. There's a lot of hands in the pot, so to speak, right? Like a lot of different moving parts. Just be patient with yourself and your food service staff. The hard work absolutely pays off, results in increased efficiency and improved workflow throughout your food service operation. So it's all worth it.
Definitely. And I'll pass to Cathy. Yeah.
I was just going to say that's so true. I totally agree with what Amanda said. And then just to add, like, I know sometimes it's scary to start something new, something different, but just try it because it might take a little effort on the front end, but it's going to save you so much time and effort on the back end, and you're going to just really understand that it's a great value to your everyday tools that you use. Just give it a go.
And Noel?
Yeah, I would say, really embracing the opportunities that technology can provide. So we've spoken a lot today about, the direct effects of this technology when it comes to efficiency and all of that. But not only can it improve and streamline all these processes, but it can really foster a culture of continuous learning and empower your team to explore new possibilities, new ways of doing things, and can really drive a lot of positive transformation in your culture.
Definitely. Okay, that's all we have for today. If you have any questions for MealSuite or Amanda or Cathy, leave a comment below and we'll get to that and answer it for you. And we hope you learn something about delivering personalized nutrition with technology. So thanks for joining. Thank you, ladies.
Thank you.
Thank you.